Welcome to the Doctoring 1 Abdominal Cluster Exam. When examining the abdomen, stand on the right side of the patient and ask the patient to lie down on the exam table. Be sure to pull out the footrest for patient comfort. Ask permission from the patient to lift up the gown and make sure you're able to visualize the abdomen fully from just above the xiphoid process superiorly to the symphysis pubis inferiorly. This may require you to ask permission to undo the belt or drawstring. Note here that the umbilicus is one landmark you can use to partition the abdomen into 4 quadrants. Next, inspect the contours of the abdomen and look for any asymmetry or obvious masses. In addition, inspect the skin for any scars, stria, or rashes. When auscultating for bowel sounds, use the diaphragm of the stethoscope. There is no specific location you need to auscultate. You can just pick a spot, since bowel sounds transmit widely through the abdomen. Listen until you can hear some bowel sounds, and this can take anywhere from a few seconds up to a couple of minutes. Next, we're going to move on to percussion. Percuss over the 4 quadrants, noting areas of relative tympany such as the gastric bubble and the splenic flexure. Finally, we're going to move on to palpation. Start with superficial or light palpation. Start away from the point of any tenderness the patient may have and use one hand held horizontally and palpate with a light, gentle, dipping motion in all 4 quadrants. If there's any significant tenderness to the light palpation, assess for rebound tenderness. This is done by palpating the abdomen in an area away from the area of pain and pushing slowly and firmly. Then quickly withdraw the hand. The test is positive if the patient has significantly more pain during withdrawal of the hand. Assuming there is no significant tenderness to light palpation, move on to deep palpation using 2 hands. Use the hand in contact with the skin to passively sense the underlying structures, while the top hand is used to provide most of the downward pressure in a dipping, sliding motion. We're going to finish the abdominal exam by percussing the liver span and then palpating the liver edge. To percuss the liver span, percuss up the mid-clavicular line, starting from the umbilicus until you hear liver dullness. Mark this point with a pen or have the patient hold a finger on this position. Then continue percussing upward until liver dullness turns to lung resonance. Record the span in centimeters. Normally, the span should be 6 to 12 centimeters. Palpate the liver edge by first placing the left hand under the 11th and 12th rib and place the fingers of the right hand lateral to the rectus muscle and below the lower border of liver dullness. Gently press in and up while the patient takes a deep breath and feel the liver as it comes down to meet your fingertips. An alternative approach is the hooking technique, where you stand near the shoulder of the patient and hook the fingers of your right hand below the border of liver dullness and feel the liver edge as the patient inspires deeply. The final maneuver is to assess for costrovertebral angle tenderness. This is performed by placing the palmar surface of the fingers of one hand on the costrovertebral angle. This is the lower border of the 12th rib and the lumbar spine, and gently striking with the closed fist of the free hand.